Hi everyone, this is Catherine England, and here is my presentation on cystic fibrosis. So what is cystic fibrosis, or CF? It's a disease that affects the cells that produce mucus, sweat, and digestive enzymes or secretions. People with this disease have thickened mucus within their body, so that ends up causing issues with blockages, obstructions of ducts and passageways. It's one of the most common genetic diseases in America. 1 in 2,500 white newborns are born with this each year, and about 1 in 17,000 Black children are born with CF each year. It is a chronic disease, which in this case means they're going to have it for their entire life, and there is presently no cure, but there are treatments, which I will touch on in just a little bit. These are just some common symptoms. The very salty tasting skin is like a telltale sign. It's actually one of the ways that they diagnose children with having CF. Lots of coughing, phlegm buildup, frequent lung infections, wheezing, shortness of breath, lots of respiratory related issues, but there are also some GI issues as well. You can see mentioned here issues with bowel movements, and then as well male infertility. So the molecular cause of CF has to do with the CFTR gene. Mutations in the cystic fibrosis transmembrane conductance regulator gene cause that protein to become dysfunctional, and when it is dysfunctional, cells are unable to move chloride out of the cell, which ends up contributing to the thick consistency of mucus. So this is just an infographic that gives you a better idea of what's going on inside of the cell. You can see chloride moving in a normal CFTR gene, and it's able to leave the cell. But in the case of an affected mutation, it's not able to leave the cell. A little bit more about the molecular cause. There are 5 different classes of specific mutations of the CFTR gene. So there's about 1,700 mutations of the gene that have been identified so far, which contributes to the varied presentation of the disease. With CF, not everyone has a really severe case, and there's quite a range of symptoms, or I guess you would say acuity of the disease. So these are some of the different classes. The first class is one in which 22% of individuals with CF have this first class of mutations. And these are the 3 different specific points in the gene that contribute to this mutation. It's a nonsense mutation, and there's also splice and deletions involved in that as well. The second class is the most common. 88% of people have this. This involves a misfolded protein. It's referred to as a processing mutation. The third class, 6% of people are affected. The CFTR protein, it's created in this case, and it moves to the cell surface, but the channel gate does not open. The next class, again, 6% of people have this. This is a conduction mutation. So the protein is created, again, moves to the surface of the cell, but the function of the channel is faulty. And then the last class, 5% of people have this. So the CFTR protein is created, moves to the cell surface, but it is in insufficient quantities, so not enough to be effective. Mode of inheritance. CF is an autosomal recessive disease, so children of CF, each one of their parents has to have at least 1 copy of the defective gene. So here is a graphic to give you a better idea of how this is passed on. In this case, we have 2 carrier parents. They give birth to 2 carrier children, one that is completely unaffected and then one that has CF. So we've got a 25% chance of having a child with this disease. The incidence of passing it along to your children obviously goes up if you have someone that has CF having children with someone that is a carrier. So in this case, we've got one that has CF, another that has CF. So that makes sense with the 50% chance of having a child with CF. And then you've got 2 carriers. So this is the inheritance pattern that I created for the assignment that we did in class. What I started with was an individual that was completely unaffected marrying a person that was a carrier for the disease, and they end up having Jack, who is a carrier, and Jack marries Jill, whose parents were both heterozygous recessive for this gene, so they passed that along to her, and she was a carrier. And then they end up having children, one that is unaffected, one that is a carrier, another one that is a carrier, and then Mike, which is their affected child, and then it goes from there. Genetic testing. The sweat test is one of the most common tests children are given at birth. It measures the amount of chloride a person excretes in their sweat. And this is actually what that looks like, the device right here. They place electrodes on the baby's arm, and then the sweat gets collected here. The neonatal CF screening test is the heel prick test. So they take a very small sample of blood from the baby's heel, as you can see right here, sent to a lab, and then it tests for the presence of immunoreactive tryptopsygen, or IRT, which is a chemical created by the pancreas. So higher levels of IRT are correlated with people that have CF. Lower levels of IRT identify people with CF. IRT DNA test is only done in certain states. So the sweat test and the neonatal CF screening test are done in all 50 states. The third test, the IRT DNA test, gives parents a little bit more information about the likelihood of their child being a carrier of the disease. So they use the blood that's taken from the heel prick test, but they also test for further DNA information. Okay, treatment options. So the goal of treatment with CF, you're obviously going to want to prevent and control infections, trying to remove the mucus from the lungs because it is hard to remove, and then treating and preventing intestinal blockages. Some common treatments, this is not an exhaustive list by any means, but antibiotics for lung infections, bronchodilators, which are an inhaled medicine, oral pancreatic enzymes, and mucus thinning drugs. Additionally, there is vest therapy, high frequency chest wall oscillation. So this is more of a physical option. So the therapy involves this vest right here and then this mechanism here. And the vest inflates and deflates rapidly, about 20 times a second. And what that's doing is physically oscillating or moving the mucus that's in the chest. And then every 5 minutes, the person will need to cough into this device right here to try and excrete that mucus. And then it's worn for about 20 to 30 minutes at a time. Genetic counseling for CF is an option for people diagnosed with the disease or parents that are concerned about their chances of passing it along to children. So they assist with assessing the patient's needs and the severity of the disease. Like I said before, not everyone is equally affected. Family planning, so if 2 people that know that they're carriers are planning on having children, helping, with that decision-making process, helping to prepare them for that. They can provide insight and analysis of any genetic testing. So as we talked about recently with The direct-to-consumer genetic tests, you know, somebody might get that result, and whether it's a positive or a negative, and they could go to a genetic counselor for more information about the results that they've received. And then they also can connect individuals to support groups if they do receive a diagnosis and need some emotional support with that. Okay, and then this is my reference page, and that is it. All right, thank you.